Is grandma addicted? Well, she might be. When we prescribe medications to our patients, we often consider a number of things, such as their symptoms, their liver and kidney function, their other medical conditions, their own history, their family history. But one of the most important factors that we consider is their age. Elderly patients have a slower metabolism than everyone else. And since most of the medications are passing through either the liver or the kidneys, a little bit of the drug goes a long way. So often the drugs will stay in their system longer and lead to major side effects. So that gets us to the benzos, also known as benzodiazepines. This class of medications includes drugs such as Ativan, Klonopin, and Xanax. And usually these medications come with a whole host of side effects. Now they're started for anxiety, but they can cause side effects of lethargy, where they're really sedated and drowsy. We're talking about shallow, slow breathing. We're talking about problems with their gait. And sometimes they'll have confusion, especially if they're elderly. Side effects are common, but withdrawal can also be pretty serious. Stopping the medications can cause really serious complications, including seizures as being one of the most dangerous and life-threatening ones. I see patients come in with overdose very often, and this is one of the medications that's part of that. The other medication group to consider is opioids, also known as narcotics. And these opioids include morphine. We're talking about oxycodone, hydrocodone, also known as Percocets and Lortabs, and fentanyl. And in a combination with benzodiazepines, they can cause some serious life-threatening respiratory depression. These patients will come in, they're altered, they're not acting like themselves. In serious cases, they're in a coma and they have to be connected to a mechanical ventilator, also known as a life support machine. Benzodiazepines and opioids are dangerous. The benzodiazepines are often started for anxiety, but there are safer alternatives. Opioids are usually started for pain control, and that requires a more detailed and nuanced conversation with the doctor. These patients have to see their physicians, and they have to have a detailed discussion about what their goals of care are, and the physicians will often have to create a plan to try to get them off the benzodiazepines or the opioids. It can be very challenging to do that. I learned long ago that when prescribing in the elderly, you have to start low and go slow.